I think we need to look at the political and economic circumstances, particularly around this particular disease, both in the United States, in Western countries, in terms of the funding for research, where that's coming from, and in terms of austerity in Europe, but also austerity in West Africa as well. There's sort of two prongs to this. The first, of course, was that over the last few months we've seen over and over again people from the CDC, senior figures from the WHO, even John Ashton, the head of the UK Faculty of Health, who've said basically that the knowledge is there, the know-how is there. We have 5 candidate vaccines. There's a number of other different treatments that are are well in hand, but there just hasn't been any buy-in from the major pharmaceutical companies. John Ashton, as I was saying, from the UK Faculty of Health, which sort of the doctor-in-chief, if you will, in the UK, described this as the moral bankruptcy of capitalism. It sounds quite vituperative there, quite explosive language, but it really expresses the anger that a lot of the researchers feel about how look, we know what to do here, but this is just an unprofitable disease.
So could you elaborate, Leigh Phillips, on the point that you make in your article about why it is that pharmaceutical companies are more interested in funding medications that people have to take over a long term rather than investing in one-off medicines like vaccines?
It's fairly straightforward, and it's not the argument is not that the major pharmaceutical companies are somehow evil or malevolent. This is just the way that the free market works. If Ebola, like many other unprofitable diseases, is something that basically, if we're going to resolve the situation, we're going to basically cure it. We're not going to handle it for the long term, where we want something that some drug or some vaccine or some treatment that people are going to take once, twice, maybe for a short period of time, but then that's it. We don't want to be dealing with this for the rest of the somebody doesn't want to be dealing with this, obviously, for the rest of their lives. Compare that to the situation with, say, insulin for diabetes, or other drugs that people might need to have to take every day for the rest of their lives. Any sort of major pharmaceutical company, if they're trying to decide where they're going to invest their, roughly maybe around $1 billion investments into any new drug, are they going to invest that money in a product that is going to have a very low return on investment, or not much of a return on investment at all, or something that is much more likely to have quite a high return on investment? It's a bit of a no-brainer where they're going to allocate the bulk of their money. And so what we see here is Ebola is, in many cases, is just an example of a wider problem that we have with pharmaceutical research. Antibiotic resistance right now is a very, very frightening situation, where we are facing a sort of 30-year, what's called in research journals, a discovery void. That is, that pharmaceutical companies have for about 3 decades now refuse to engage in the development of any new classes of antibiotic, and we're really coming towards the end of the efficacy of the antibiotics that we have in the cabinet at the moment, and we have about 5 to 20 years left before we see a sort of fairly rampant increase in deaths from bacterial infection. One of the really frustrating things with this particular issue is how it really demonstrates as John Ashton wrote in the UK, the moral bankruptcy of capitalism, not just on the one end in terms of research, but in West Africa as well, and Spain, we see that the same processes, the same free market driving ideology that it has reduced these countries to real dire poverty. These three countries are some of the most poor countries in the world, and when I say most poor countries in the world, I mean really right at the bottom of the global league tables.